town hall event going, and hopefully, get some great information. I want to first bring Mr. David Lowery. Hopefully, I pronounced his last name correctly. Ah, you looking shy. Wait,
Hey, what's
hold
going on,
on.
Yolanda?
No, I ain't even expect that. You kind of threw me back. You look amazing. Thank you
Thank you.
so much. Um, and I understand you are the president of, I'm reading this, of the Living and Driving While Black Foundation. And you told me you have one of the hottest talk shows, right? Let the
Yes, I
truth be
do.
told. Okay, okay.
Every Saturday at 1 o'clock.
Okay, every Saturday at 1 o'clock. So tell us just a little bit about you. Then we're gonna move on and bring on the other panelists.
Well, my name is David Lowery Jr. I've been a two-time president of the NAACP once in Rock Island County, Illinois, here in Chicago in the South Suburbs. I was also the National Crisis Director for Reverend Al Sharpton out in New York. I've had an opportunity to work with the greats Johnny Cochran, Sammy Rubenstein, George Hardy.
Nice.
Um, I did a lot of work with the National Action Network. And after our first convention, I wanted to move back to the Quad Cities where I was living at the time. And so I sort of felt that there was issues that were not being addressed in the Black community. And as a
Mhm.
true activist and a man of God, I stepped out on faith. I started living and driving while Black. Living conditions and driving conditions are the worst for Black people on the face of this planet. And we started to address those issues, and we made a lot of waves in this country. We filed certain legislation, House Bill 5665. It was
Mhm.
my organization that wrote the racial profiling bill,
Oh wow.
which Obama took and got
Mhm.
passed through the Senate. We gave it to Monique Davis. It got through the House of Representatives. And instead of making it a law, they made it an act, which is about to be out. And we're looking at continuing to write legislation and stand up for people in the community that's less fortunate than everybody else.
Right.
Ex-offenders, we work with people from the streets, street organization, GDs, BDs, vice lords, you name it. We have a relationship with people. We have a relationship with the militias across the country with Josh Ellis. And so we're trying to unite the American people to get together and be on one accord so that we can take this country back and put this government back in its place so that
Mhm.
we, the people, can run the United States again.
All right. Well, no wonder you looking so sharp. Because you're doing a lot, and having, it seems like a positive impact on the community. So thank you for being here. I'm gonna bring on our next panel. Listen, I'm gonna try to get this right. Nurse Quita Stokes. She is the founder of L&S Farmer House of Hope and Health, and she is also a wellness coach. Hello, I call her nurse. She know that she like my personal nurse. I call her Nurse Stokes. That's the person I call when I have a question, anything related to healthcare. Thank you so much, beautiful, for being here. You look great. Why don't you tell us a little bit about who you are? I can't hear you. Can you?
No, I don't hear.
Okay. Mm-mm. I think that's it. No, no. You got your mute off. Uh, Okay. Hold on. We're gonna come back to you. We're gonna try to figure that out. We have our tech support is definitely gonna help you figure that out. But let's bring on next Miss Phyllis Rodgers. She is the founder and CEO of Peer Plus Education and Training Advocates. How are you, lovely lady? Thank you for being here. Can you share a little bit about who you are?
Thank you for having me. It's been a long time trying to make time to get on the show, so I'm glad that it's this topic that I'm able to join you. Thank you. I am the founder of Pure Plus Education and Training Advocates. We are a registered nonprofit in the state of Illinois since 2002, so we're now in our 20th year. We provide support services and resources and educational programs to the community. Our main focus has been the whole person, not just one disparity. Um, Once you get the disparity underhand, then you have to work with the whole person,
Mm-hmm.
whatever it's around. We are the referral piece.
Mm-hmm.
So I'm writing down information now about Mr. Lowery, to make sure that we're able to join him and to
Mm-hmm.
support him on his Saturday radio show. If you can tell us before it's over, what channel. I do have 1 p.m., but I don't know what station to tune in on. But we are your go-to. We've been considered your boots on the ground. We've been around for a very long time. We started out in the time of HIV. That's when we met Mr. Don Doty with the Doty
Mm-hmm.
Foundation. And so we've been in partnership with him over several projects over the years. And so that's just a little bit about me. And we are here. We're here to continue to forge on and to do the best that we can to bring it to the community at the level of their understanding.
Well, I love it. I love making connections and
Yes,
love having people that are about the people. That's
absolutely.
definitely part of who I am and
Yes.
part of my platform. So we're
Mhm.
going to move on to bring on our next panelist, and Dr. Yadav. And I'm hoping I say this. Hoping I said I got it right a little bit, but
Very
he is
close.
close. Okay. He's the vice president of quality and process improvements at Loretta Hospital. MD, MBA, LBBA. Love it. Thank you for being with us, doctor. Please share with us a little bit about who you are.
Thank you, thank you. And I'm so glad you did not call me right after Mr. Lowery. So wearing that suit,
Right.
I was hoping I wouldn't have to follow him. Yes, so Rohit Yadav. So I'm the Vice President of Quality and Process Improvement at Loretta Hospital. So I oversee our internal quality as well as process improvement projects at the hospital. We are a safety net hospital in the west side of Chicago in the Austin neighborhood. So we serve predominantly a Medicaid population. Most of our patients are people of color. We are one of the smaller hospitals in the city of Chicago. Now, being as a part of a safety net hospital is kind of a personal passion of mine. So even during medical school, I did most of my rotations in the south side of Chicago and the west side of Chicago. So most of my career has been devoted to helping these safety net hospitals. And now over at Loretto, we are being led by Mr. George Miller, who has made it a personal goal of his to help address healthcare and disparities, throughout throughout Chicago, but throughout hospitals in Illinois as well. So we're very much aligned in that mission at Loretto Hospital.
Nice. Well, thank you. We really, really appreciate you being here. I'm just going to make sure that we are live also on Facebook. I don't know. Nurse Stokes is still trying to get back. So we'll get back to her. So I'm going to get right down to it because we all have lived this since March 17th, somewhere around there, 2020. We've been quarantined. We've been shocked by what's going on. We've been shut down. And now as the world begins to open, there's a push for, and I'm sorry, I'm just trying to see, we're going to bring Nurse Stokes back. And okay,
Can you guys hear me?
we can.
Okay. All right. Technical difficulties. So thanks again, like I said, for having me, Yolanda. Yes, so I'm Quita Stokes, and I've been a nurse for over 15 years. I've done so much. I am a new nurse practitioner. I'm excited about that. My passion has always been community and education. I also work with Dr. Rohit over at Loretta, where I serve as an administrative house supervisor on the administrative team. And I am currently, I also launched a company that is a year old called LS Farmer House of Hope. And basically, we're a mentoring and transitional program, and we're basically reaching out to middle-aged and high school youth, and we will be providing them with counseling, healthcare, and housing to help them to transition and reach out to our youth in the community, because that's what's really needed right now.
I love it. So what I love, I'm getting some back feedback. Is that me? Let's see. So what I love, can you guys I think Quita put you on mute. Thank you so much. So what I love about this group here is that everybody, even though we have two healthcare professionals here, are community oriented, and that is so important, because that's our target. You know, underserved the community, the minority community, those that typically don't have access to quality healthcare, typically don't get the real information or the right information in order to make really, really informed decisions. So are you on the fence? Do we have people out there that are on the fence about this vaccine? I am going to start with Miss Phyllis, and I hope she don't mind, because my understanding is that you and your family had COVID-19. So I just don't want to dismiss that. I want to know if you're willing to share a little bit with us about what that was like for you and what was your experience, and to even give people who may feel like, yeah, this I don't know about this COVID-19 thing.
Well, sure, I don't mind sharing my story anytime that I can, and hopefully it will reach at least one person, and to know that it does make a difference. My family, myself, my husband, my son, and my daughter, we were all had our battle with COVID November of 2020. It's a horrible, horrible experience. To go through it and to not really know what to do, because if your symptoms are not bad enough, you're not hospitalized, which is a wonderful thing. You're just sent home to fight the battle by quarantining and doing the very best that you can. But in my case, my husband was hospitalized for 1 week. And it was a frightening experience, because he had went 2 weeks prior before the actual diagnosis. We pretty much thought that's what it was, but he was denied a COVID test at one of our community hospitals. And when it came down to it, we had to get the ambulance and the fire department involved to get him from the home to the hospital where he was diagnosed. And, running the temperature, had everything that was going on, difficulty in breathing, cognitive was all over the place, didn't know where he was, couldn't make any rapid sense out of anything that was going on. And after he was admitted, I took myself straight to an examination location. And I knew I was positive because I've worked in infectious disease for 20 years. So I had every symptom, that I knew that was going to be there. It was one of the worst headaches I've ever experienced in my life. Joints was just all over the place. My son and my daughter both had issues with taste and smell, severe headaches, just lethargic, no appetite, none of that. And this was right early November. And because of the work that I do, I'm faced with it. We're still working from home, but we're constantly being bombarded with people that we know that are asking questions and dealing with COVID. I mean, last year we probably lost at least 12 people that we know. One of those was a family member that had COVID twice. No one talks about it, and I'm sure the providers can talk about that, that you can get COVID twice, and that you can get COVID after you receive the vaccine. I think a lot of people
Yes.
have that. They just feel, well, oh, I've gotten the vaccine, I can't get COVID. Yes, you can. It's not an all-time cure, because if the providers will explain later, probably they're still figuring it out. They don't have all the answers. We have a long, long way to go. But my family, you know, in the very beginning, everybody was making jokes about, you know, what was going on, and you're going to grow horns and grow this. But we've all taken the vaccine. I took Johnson and Johnson, and my husband and my children, they took Pfizer. And so right now we're all vaccinated. And when I'm in the community, last weekend we hosted an event out in Thornton Township. And we had quite a few people to come, and we called it the one and done, Johnson and Johnson. So we encourage people to come and take the vaccine, but we also encourage people after you take the vaccine to still receive a test based on your work habits and what you're doing and the people that you're around. I'm not telling anyone to take the mask off. Please don't take it off. Please don't take it off. I know we are happy that we can go different places and we can sit in restaurants and bars and have all the good time. I just don't think it's as safe as we all want it to be at this time, because there's so many unknowns. There's so many unknowns, and a lot of things that we're sitting back and waiting to see how it's going to open up and to transpire. It is a hard nut to crack. It's hard to give that information. It's not difficult to give that people that information, but what I find is you just give the information the best of your ability and then step away, because people have to make their own choices. What works for me and my family may not work for the next person, but I'm eager to share what my family has been through. Now we are all considered long haulers. We're the long haulers. I battle with fatigue every day. My son and my daughter are still dealing with taste and smell. It hasn't come back 100%. Some things that they used to just totally enjoy, they can't even stand the smell. The aroma just makes them feel ill. You know, so Peer Plus is in the battle. We're here to do whatever it is that we can to continue to bring the information. And especially we work a lot with our seniors to make sure that they have the information and that they understand it. You know, whatever it takes to break it down to a minimum, that they can understand that that the vaccine is important. And no one pushes them. Just say, let us know when you're ready, and we'll do what we can to support you.
Right. Well, thank you so much for sharing your story, and how grateful it is to be a long hauler.
Absolutely.
In this case. We, you know, blessings to you and your family as you continue the recovery. You know, this is a town hall meeting, virtual, you know, anybody can jump in. I'm going to go to the doctor and just allow him to share a little bit, you know, with us from the perspective of a doctor, you know, and someone that's in the hospital, and I'm sure has been in the hospital during this time. What do you have to say to us as it relates to the vaccine?
Thank you, Yolanda. I do want to take a moment to thank Phyllis for sharing your story. And you know, we see this time and time again at the hospital, and we're still seeing it at the hospital. So from our perspective, I know if you step out into the environment or into the city, it may look a little different. But when we're inside the hospital, we're still seeing patients coming in. We're still seeing people with these symptoms. This is still very much something that is happening to us right now still. And I do want to echo what Phyllis mentioned. So yes, if you've had COVID, you can get it again. If you've had the vaccine, you can still test positive for COVID. And added to that, they're still studying the transmission rate after people are being vaccinated. So we know transmissions do go down, but it's still not something that's completely ruled out. So you could have the vaccine, but that does not mean that you can't give it to somebody else. You can't be a carrier for COVID. You can still give it to somebody else. So these are all things that we want folks to be well aware of. As you hear the good news, it's still something that you need to keep at the forefront. If you can, please continue to wear the mask. If you have the vaccine, please understand you can still give COVID to folks who might not have had the vaccine. We're having this town hall, and again, the topic being, are you on the fence? There's a large number of people who are still on the fence regarding the vaccine. So that means there's a large number of people who have not received any sort of protection against COVID. Now, from my perspective and what we're doing at Loretta, we see that healthcare disparities has affected the vaccine as well. So we know that people of color were disproportionately affected by the virus. So they had higher rates, a higher impact in terms of incidents, in terms of economics, all around. When it comes to the vaccine, we see that the vaccine uptake has kind of followed the same trend. So we're seeing that there are lower numbers of folks being vaccinated in the African American community, in the Hispanic community. There have been big pushes, both at the federal, state, and city level to try and close that gap, but the gap still does very much exist. It's the last 2 weeks, progress has been made in terms of having Hispanic folks getting vaccinated, but there's still a large gap in terms of African American folks getting, vaccinated. And that's something that we're very much trying to address and see what the hesitancy is behind why folks are still not certain about the vaccine, which is, makes me very happy that we're having this town hall. So from a provider perspective, we want to hear why people are hesitant about the vaccine. What can we do to, get folks to kind of cross that threshold? We're in a point now where we're seeing we have an abundance of supply. So we have sites open where there are no lines. We have appointments slots that are going unfilled. We have vaccines essentially sitting on the shelf. So at this point, we just need to get the folks in to get those vaccines. Simultaneously, we understand it is difficult for some folks to make the time or the effort to come into a vaccination site. So some of the later efforts that we're doing now is to take the vaccine into the community. So for example, with Chicago, we've transformed some of the city buses into mobile vaccine clinics. And now we're starting to go into some of these harder hit communities to be able to provide that vaccine. And the latest thing is we're allowing folks who are homebound to even schedule a home visit where the vaccine will come to your house. So you're able to get that. So we're opening up as many avenues as we can, but we still need folks to share with us why are they hesitant and what we can do from the provider perspective to help them, be okay with the vaccine.
So something tells me that David can probably help us. I don't know. Something just tells me that David can probably provide us with some insight on the hesitation or why are people on the fence, and I can't say, and I'll throw it out there, when you do hear you can still get the vaccine, or you can still, so that's, for many people, that's all they hear. So then you go, well, why should I get the vaccine? But I'm sure David has some more insight that he would love to share as well.
First, I want to give all praises to God and my Lord and Savior Yahshua for making it possible for me to be here. I want to lay a little groundwork for everybody on the panel today. The COVID has created a lot of fear, hysteria, psychological warfare amongst the American people. And so the media, politicians, and all of them have continued to pound the American people with the numbers of COVID every day. People who tend to stand up, and there are a lot of people, a lot of doctors who have been part of this, and doctor, you might know this as well, have stood up and came out against this, not a vaccination, but an experimental drug. First of all, the vaccination was not vetted long enough to be called a vaccination. Secondly, this experimental drug cannot even stop COVID. And now, if you really want to talk about it, when it first came around with this experimental drug, they stated that you could take it and you wouldn't have to worry about dying from COVID, thus making this vaccination an image of God, which was not true. As things continue to roll on, then they started talking about, well, if you take the vaccination, it doesn't mean that you can't catch COVID again. Mm-hmm. And so as these differences continue to go through the community, the people in the community are asking one simple question, and this is for anybody on the panel. If you're fully vaccinated, first of all, the vaccination or the experimental drug cannot stop COVID. And if you fully get vaccinated, you're still able to catch COVID and die from it. So the question of the people is, what's the use in taking a vaccination that cannot stop or destroy this disease or virus, or what you want to call it? And in the past, vaccinations for polio took care of it, the measles, these vaccinations eradicated those type of diseases or whatever. So common sense would tell you that why would I take and shoot something into my arm that cannot stop COVID, and being fully vaccinated, I still can die from that. Mm-hmm. And so a lot of people are asking these questions, and these questions are not being answered totally. I want to give some numbers up because, see, the American people have just, I would say they have not been informed fully about what's been going on with this whole plandemic. I call it a plandemic. Some of you folks might disagree with me, and I think that it's about the math. If you have, say, for instance, 604,000 deaths and a total number of cases of 33 million COVID cases, the death rate from that, if you divide 604,000 by 33 million times 100, that's 1.8. So what that means is that 98.2 people survived COVID and only 1.8 died. So that's not a huge number because the flu have taken more people than that. Like the year of 2017, 2018, the flu infected over 40 million people. But at the same time with the flu, we never shut our country down. We didn't close our businesses. We didn't close our churches. We didn't do none of that. And so because of the true fact that the true numbers haven't been given to the American people, because if you listen to the news, they're not saying actual COVID cases. Now, I'm not saying COVID is not real. It is real. It's just real as the flu and every other virus that comes around. But what I'm saying is that such a low number at 1.8, if you really do the math, it was not strong enough to set this country down. And so the American people have not been shielded with the true numbers. Now, we've done some research at Let the Truth Be Told, and we, about 6 or 7 months ago, we asked actually, I think it was in October, what was the actual numbers of actual COVID deaths? Because see, what the media is pushing, what some of the healthcare organization is pushing, they keep pushing the fact that the numbers are so astronomical, but in actuality, they're not true. Everything that is being said, and to the American people, if you listen to the news, if you think back, I want you to open your mind and I want you to think. Every news media have been talking about COVID related. See, the key word is related. That means that everybody that died, because I know we talk about this all the time. You don't hear nothing about people dying of strokes anymore. You don't hear people dying of the flu anymore. You don't hardly hear people dying about car accident, heart disease. You don't hear about nothing about people dying about anything. There's even been reports that people that died in car accident ended up being on the COVID list that's dying from COVID. And so when you start talking about the actuality of things and you say COVID related, then you're adding not just the pure COVID deaths, but you're adding everything else that other people die from as COVID related to boost the numbers up to continue this psychological warfare on the American people. And so a lot of people aren't as sleep as the government thought they were. Mm-hmm. And I just think that this vaccination that had already been proven, because they have breakthroughs already, where people have taken the vaccination and they've died from the vaccination. Let's take Johnson & Johnson. All of these, Johnson, Pfizer, Moderna, all of them have problems with this vaccination that can actually kill you. And so if you look at the numbers, if the people start doing the research and look at breakthroughs, is what they've been called, on how many people who have taken this vaccination and have died, how many people have taken this vaccination and a week or so later, I know friends that have taken it and they have ended up in the hospital with respiratory problems and all sorts of other ailments that they received after they received the shot. And this is something that I'm going to say this because it has to be said. In the vaccination, there's a synthetic DNA. Is that correct, doctor? Called mRNA. But anyway, there is a synthetic DNA that's been put in this vaccination. And I want to read to the listeners exactly what's in this vaccination that I believe and we know that can harm you. Okay. This is what mRNA is. Messenger RNA, or mRNA, plays a fundamental role in human biology, transferring the instructions stored in DNA to make the proteins required in every living cell. Our approach is to use mRNA medicines to instruct a patient's own cells to produce proteins that can prevent, treat, or cure disease. Now, if I'm correct about this, and like I said, we've done some research, and doctor, you correct me if I'm wrong. This mRNA is a synthetic DNA. And so its job is called gene therapy. It is supposed to be able to connect to your DNA or somehow in your body. It is supposed to tell your cells to reproduce protein to fight off the viruses. And so my thought is, if you're going to put this in a vaccination or an experimental drug, the people of this country need to know that that synthetic DNA can change your normal DNA, because if it's giving your normal DNA orders to create protein, then that could be a problem, because if it doesn't mesh, or if your normal DNA does not accept this synthetic DNA, it starts to shut the body down, Doc. So can you explain to me why that they have put this into this vaccination, and why that if this vaccination or this experimental drug cannot stop COVID and you still can die from it, and then you still run the risk of being vaccinated and dying from the vaccination, what is the purpose, and what does this experimental drug serve to the American people, and why would you implement a synthetic DNA into a human body made from no telling what to try to curb a virus or disease like this, and yet it cannot?
So, and I want allow you, the doctor, to respond to that, and Nurse Stokes, definitely come in, because what I know about you is that you are a healthcare professional, but you're also very community oriented. But even to sum it all up, as I'm looking at some of the comments that's coming in, I saw one person say, like, we just don't know. because we hear so much. We hear so many different stories. I mean, even and I smile and chuckle because someone says, well, you got the vaccination. Are you going to be a zombie, in 5 years? So, and it's serious, but it's like, where does all that come from? So I want to allow definitely the two healthcare professionals to respond, and I allow David to continue because we want to know, you want to know what's going on in the hearts and in the minds of those that are still on the fence, and we want to be able to give them the right information. So, go for it, Dr. Sweet.
Okay, sure. I do want to start by saying that the COVID vaccine cannot change your DNA at all. So when we think about mRNA, the way the cell structure is, a human DNA sits inside the nucleus of the cell. So you have the cell, inside the cell you have a small nucleus. That's kind of, imagine the center. It's very well protected. And inside the nucleus is your DNA. And very, very little things can actually cross both the cell's barrier and then cross the nucleus barrier. mRNA, this vaccine, this is not one of those things that's going to cross into your nucleus and go into the center and affect your DNA. So it's not one of those. What it does do, mRNA is essentially the blueprint to teach your cell how to make a small spike protein. So when we think about the coronavirus, and you've probably all kind of seen pictures of the virus, imagine a circle with spikes all over it. So what this mRNA vaccine does is it teaches your cell how to make just the spike, not the full virus. So your cell will never know how to make the full virus. It will learn how to make the spike protein. That's all we're teaching the cell. And this learning happens outside the nucleus. So away from your DNA, your body is learning how to make a spike protein, not the full virus, just the spike protein. And what that does then is when your body knows how to make the spike, it knows how to beat that spike, because then your immune response kicks in and it beats the spike. And from there, your body learns, okay, the next time I see something that has this spike on it, I'm going to beat it. So that's where your immunity is kind of coming from, is from that learning that happens. Now, when we think about, I'm just going to kind of work a little bit in this direction from what I heard from Mr. Lowery. I'm going to kind of go in this direction, right? So when we think about, okay, well, so I'm going to give the cell the blueprint to learn how to make the spike and then how to beat that spike. How do we get to this so quickly, right? So we think about vaccines that are not mRNA vaccines, your typical vaccines, like Mr. Lowery mentioned, like the smallpox vaccine, right? In those vaccines, we know, most folks know that, okay, it's either going to be a killed version or it's going to be a weakened version that they're going to give me, or they're going to give me a part of the virus and my body's going to learn how to beat it. Before we got to that step, how did we even arrive to those vaccines? So that's where a key distinguish, and I'm going to kind of spend a minute on this because that's the kind of key to explain the timeline. I know the timeline for this vaccine worries a lot of people. So I do want to kind of explain how the other ones were made and how this mRNA is unique in its production. So when we think about other vaccines that have been produced, they do take essentially the same methodology. So they do take a part of the virus. But when you have that little part and you need to make a lot of vaccines, you have to mass produce these small pieces of virus, right? So what they do is they go ahead and they use, similar to the Johnson vaccine, vector vaccines, they use bacteria and yeast to create small pieces of the virus that they want to beat. The problem with that is if I'm going to essentially grow my vaccine is what I'm doing. I'm not producing it, I'm growing it. If I have to grow my vaccine, it's going to take a very, very long time to grow it. Imagine, for the sake of conversation, imagine I'm growing a vaccine inside of a petri dish. It's going to take me a long time to grow that vaccine. Then I have to extract it. Then I have to mass produce it. That was the traditional method of creating vaccines. This mRNA process is unique in that instead of having to grow the vaccine and kind of build it inside of bacteria, then extract it, I can just teach my body directly how to produce that protein and how to beat it. That's why the timeline for this was a little bit quicker than previous vaccines, because we're not having to spend time to grow it. We just teach the body. We just give the body a blueprint. So there's two really ways to go about it. I could either give the body a part of the virus and teach and it'll beat that part and then learn from there, or I can just give it the blueprint of the virus and it will learn from the blueprint and beat it on itself, beat it on its own there. So that's where when we think about mRNA vaccines, they're a little bit faster because we're giving it a blueprint on the spike protein. Learn how to make a spike and to learn how to beat that spike. And that's why this one was a little bit quicker to market. When we think about, okay, well, it's not, you can get the vaccine, but you can still have the virus. So what's the point of getting the vaccine? Well, you can have the vaccine. When you get the virus with the vaccine, the severity of illness is what is going down. If we take a look at our hospitalization rates, they've decreased dramatically. We take a look at our ICU rates, they're decreasing dramatically. If we take a look at our ED visits, they're decreasing dramatically as well. So the effectiveness of this is pre-vaccine. This is something that has a higher chance of landing you in the hospital or in the ICU and even death. Your chances are much higher. Your chances are a lot lower with the vaccine. So that's the key message here for folks. There are folks out there who, without the vaccine, if they got the virus, their chances of survival will be very low. You take the vaccine to help mitigate the damage that COVID can do. As we heard from Phyllis, the damage is not just, well, I had it and I lost my sense of smell and it came back 2 days later. Some folks, you're in the marathon stretch. You get this and it's going to be with you for years on end. Now, compared to the alternative, you have a vaccine which is going to prevent the severity of illness. You may have a rash or you may have a fever for 2 days, 48 hours. And then you have that knowledge that, okay, even if I do get the virus, I'm not going to, there's a very, very, very good chance I'm not going to end up in the hospital because I've had the vaccine. And then the last thing, and the first thing Mr. Lowery mentioned regarding why this is not the same as smallpox and how we eradicated smallpox. We're doing the same process now that we did with smallpox. We did not kill all of smallpox in the world by using a vaccine to fight a smallpox and then kill all the smallpox viruses in the world. What we did was we essentially gave smallpox no place to hide. We vaccinated as many people as we could. Smallpox was going from place to place. Eventually, first world countries, second world countries, third world countries. As the vaccine followed smallpox, we gave it less and less people and host and place to be. And from there, we can say we eradicated it, but it was not necessarily a one-to-one fight. We just vaccinated as many people as we could, and that herd immunity is what killed off smallpox. And we see 1 or 2 cases will still pop up in a place that doesn't have as many vaccines. And it's very much tied to that herd immunity concept. You have to give it no place to go. and eventually that number will come down on where it exists.
Wow. Well, that was, thanks for responding. I want to give Nurse Stokes an opportunity to share because I know her, she's definitely someone that I call on about anything healthcare related. And I also know she is very much a community advocate, community organizer. She's definitely a community educator. So can you just share with me your thoughts from the perspective of being a healthcare professional as well as just a mom, just someone in the community?
Yes, thank you. Well, you know what? I don't know if they're ready for me because they call me the realist health and wellness coach. So I need to talk in layman's terms to our people because I try to stay away from the debates and the conspiracy theories because it really upsets me. Because the people that's coming up with the conspiracy theories are mainly minorities. And the minorities are the ones that are the ones that are dying from this disease. This is something that's near and dear to my heart because Yolanda, as you know, I lost my grandmother was a part of the first batch of people that died from COVID. COVID hit us in March. My grandmother died in April. Okay. Now, my grandmother is the reason I am who I am. My grandmother sacrificed everything for me to be Nurse Wiley Stokes. Okay. So that put a damper on me in a lot of ways. I have an autoimmune disease, lupus. So I totally get it. If anyone should have died from this disease or caught this disease, I could have been one. However, being educated is the main thing that you can do. Being educated. I tell people all the time, all the people that's giving me this conspiracy theories, I say to them, unless you live in a bubble or on a rural area and you're growing your food, everything that you inhale, everything that you put in your mouth, you can die from. Okay? The flu shot, people take the flu shot. The flu shot does the same thing that the COVID vaccine does. You can still get the vaccine. I remember when I was doing my nurse practitioner residency, I remember the pregnant women getting the vaccine, and I remember the women that did not get the vaccine, and the outcome was different. A lot of those women were severely ill. Some of them lost their children. So when they came in, we would advise them, you should get the vaccine. And it's not rocket science. And, I don't try to persuade people, but I think in April, the end of April, the numbers showed since last year to now, April to last year to now, I think it was 101 million people that was vaccinated. Okay. 101 million people at the end of April, the CDC reported. Out of that 101 million people that was vaccinated, 0.01% was infected by COVID again. That's a very low percentage. And the people that's coming into the ERs or the EDs or getting sick from COVID, the mortality rate is nowhere near where we were last year. Mm-hmm. So I say that to say, we need to get on the ball. Most of the minorities are the ones fighting diabetes, hypertension, COPD, because we're not utilizing the resources that we have. So, just like Mr. Lowry, I get it, but I want to be me working in an underserved population. I see it. They're uneducated of why this is important or why they need it. So that's pretty much my stance on it at this point.
I would just like to say we live in a media driven world. Mm-hmm. Some good, some bad. Mm-hmm. You have to pick and choose what piece is going to fit you. I have this life. I picked this light. I tried three different ones before I got the right lighting to fit what was going to be for
Right.
this evening.
Mm-hmm.
But the choice for me and my family was the choice that I think was the best one that we made because I've seen it firsthand. I've lived it firsthand.
Mm-hmm.
I am a 19 lymph node stage 3 colon cancer survivor.
Mm-hmm.
Mm.
Watch the doctor sit up when he hears that. So a part of me, I did not know what to do, but my doctor said, you do better taking it than risking getting COVID again and being on your stomach on a ventilator. So that was no other thought for me than to go on and to get the vaccine. If you've seen it in your own person at a first hand, it gives you a different look. Now
Mm-hmm.
we can look at the numbers, we can look at the statistics, but as Quita was saying, when you're working with these people at the community level, you have a whole different ball game to be able to get that information. And all they want is one thing to make them say, I told you so. I'm
Mm-hmm.
not going to do it.
Mm-hmm.
And we can't make anyone do anything because there are choices. That is what's so unique about being human.
Mm-hmm.
You can make a choice of what is good for you and
Right.
your surroundings and whatever's going to make you who you are.
Right.
I don't try and force it on anyone. I just share my truth. I look
Mm-hmm.
at the numbers, but if you stay in the numbers too long, right about now, I'm surprised all of us have not lost our minds. We've been on lockdown, but you know what?
Mm-hmm.
But I'm still able to get up and continue to make it happen.
Mm-hmm.
So I
Well,
just think we just have to be really, really careful in how we put the information out there. You know,
Mm-hmm.
I worked in HIV for 20 years.
Mm-hmm.
It's kind of laying low. People say, you don't see the billboards anymore. What is this? What is this? Why? I don't know who's on here because it began to look like us. And when it began to look like us, they said, let them take care of themselves.
Mm-hmm.
And we asked Mr. Don Doty. That's how I met Don Doty. With the work that I was doing, and we started to partner together. So you have a person with HIV, Hep C, cancer, and then you add COVID on top of it. What have you got? You have a bomb. You
Mm-hmm.
have a time bomb. And then the doctor comes along and say, you know what? Here's the vaccine. You know, nothing is a guarantee. And we all know that.
Right.
Nothing is a guarantee, but we risk getting in the
That's for
car every
sure.
day. We risk,
Absolutely.
with the food we eat and everything else
Yes.
we do.
Yes.
So we are chance takers. We chance takers. And for me, I'm glad that my family and I and my surrounding friends have made that decision. I don't push anybody away because of their choice, but I make sure that I look at it and I got the mask on. You got to keep, why? Because I'm at high risk for everything.
Mm-hmm.
I'm at high risk,
Mm-hmm.
not just for COVID, but for anything. Do you know what it's like to be a cancer survivor and have to sit there and wait to see what your next report is going to look like? Do you know how on edge you are with that anxiety? And then they add something else to it. So
Mm-hmm.
we just have a long way to go. And it's not to beat up anything or anybody. That's what's so unique about a panel. You have different opinions and we all learn something. And I appreciate it. I
Right.
appreciate it.
yeah, we have,
I'm just hoping that those that are tuning in, that the conversation is not getting too heavy, that they turn
Right.
off.
Right.
And that's what Quita was saying. We want people to be able to put something in that chat box,
Mm-hmm.
and that because we are number driven. But
Mm-hmm.
being here in healthcare, we're healthcare driven because we see it in a different way.
Mm-hmm.
We see
Absolutely.
it in a different way when she's at that bedside and she's got to put this on and this on and he's got to put on that, and then when you come back from break, that person you were serving is dead. That's a different thing.
Okay.
Mhm.
Okay. Can I go
That's a
now?
different thing. So I appreciate everybody that's on here and the information. I like it. Thank you.
Yeah, yeah. It's definitely doing what we wanted to do, and that is
Absolutely.
be able to give out information. And you're right, we can't force. It's not about trying to push anyone in any direction. It's just about, because most in our community, we're doing it because she did it, or we're not doing it
Right.
because he didn't. And
Right.
I think we just need to be a little bit more informed across the board, from David to Quita to Doctor to, we just need to do a better job of making decisions
Telling the
based
truth.
on some information, and not kind of like just because.
Absolutely.
Um,
I agree. I totally agree.
yeah,
Is it my turn yet?
sure, David.
Listen, first of all, I want to address you, Nurse Stokes. I lost my mother February 15th of 2020. A few months later, I lost my father September 21st. During the time that my mother, she had Alzheimer's, her body wore out. And at the hospital at the time when she finally died from not COVID, but from Alzheimer's, there was a problem with me because the hospital wanted to put on her death certificate COVID related. And because of the respirator she had been on, all the money that they made off the COVID related, the 40 some $1,000 a day for the respirator to test the money. So when you talk about personal, it's personal to me. September 21st, I lost my father to kidney disease. We experienced the same thing. Instead of wanting to put kidney disease on the death certificate, they want to put COVID related. And so these things that are not true is what the American people are facing. You keep giving out the wrong information. When this thing first started, they said it wasn't airborne. You could wash your hands and you're good. Later on, they said it's airborne. Now you need to wear a mask. It got to be a Simon Says thing that Dr. Fauci would say one thing, the next week he would say another thing. And so the American people were confused. And I think, honestly, that this whole thing was a pandemic, because out of all this confusion and chaos, and now I want to shift the gear right quick. Let's talk about these vaccination companies. Let's talk about Pfizer. Let's talk about Moderna. These same companies, before they even started to work on this vaccination, had already asked for immunity. And so they are already in court, all three of these companies, for billions of dollars for bad practices, all sorts of malpractice, all sorts of other things that they have done that has not been ethical as far as research and dealing with people. And so when the American people start to take a look at all the falsehoods that haven't been true, and then you're talking about nobody at no time, because y'all want to know what the deal is. This is what the deal. Nobody at no time have came to the American people and said the formula that was being used to make all these restrictions. And so when you got governors overstepping their boundaries and continue to implement restrictions and not informing the American people, not using the legislative process to be able to get the information and get the American people input, because the American people is allowed to worry about their own health. The government cannot step in and tell you what to do and what you cannot do. A lot of the stuff that happened here is unconstitutional. And so they use this emergency to step on constitutional rights. At the same time, for me, it was a population control. 80% of the coronavirus deaths were seniors in the age between 70 to 80. And so when you really start looking at this thing, and this is why the American people aren't taking the vaccination. One, because it doesn't stop COVID. It's not going to make it easier, because if you got the vaccination, you're still sick. How does that sound when you say, well, you won't be as sick as bad if you take the shot, but you still run the risk of dying from it? And so if you're sitting here trying to convince the American people that this is safe, but yet you're getting breakthroughs, and breakthroughs is when you take this vaccination and you start experiencing the side effects. People are dying from it. Nobody on this panel can sit here and say, well, I took the vaccination and I'm good. You're not, because you still can die from COVID, and you can die from the vaccination itself if you have the adverse reactions. And so you got something here that's really, to me and to a lot of American people, it's about money. Because right now, all the promotions, they've invested all of this money into pushing this vaccination down the people's throat. They've also created this facade that if you're vaccinated, you can do this. If you're unvaccinated, you can do that. It's sort of ridiculous. And the American people have waken up and started to ask the most important question in the world, why? And the scientific world cannot answer the question, why? And nobody in their right mind is going to let somebody shoot something into them. If you go get your haircut tonight and you take a vaccination, you got a free haircut. If you get a vaccination over at the club and you get it, we're going to give you a drink. So my question to the science people, if this vaccination was so good, why are the makers trying to force it down the American people's throat? You're sitting here telling the American people that if you do these things, basically what you're saying, we will pay you to take the vaccination. Why is it that these people, the medical world, why are you guys trying to shove this vaccination down the people's throat? And why are you trying to give incentives to take it? You're pushing it down the kids from 12 to 15. They were supposed to be pretty immune from it, but yet now you went got this emergency thing to shoot the kids up. But let me say this about the word emergency. The emergency has been over. So the power to push COVID on the American people has been done after 30 days. But because of the money, because of the politics, and the American people have been used as guinea pigs. And I want the American people to hear what I'm saying. We're being used as guinea pigs because this new vaccination that can't stop COVID, that all of a sudden you're going to have mRNA to come and tell your cells what to do. That doesn't make sense. If it can't tell your cells to kill it, then if I still can get it and die from it, what's the purpose? And so a lot of people are with, and they're not going to take this.
So I think that's what makes it
You can get cured in 2 weeks. In 2 weeks, if you can quarantine yourself and you can get rid of COVID, what's the use in taking a vaccination that is not going to kill it, and you can get rid of it in 2 weeks without it? Explain that. So what's the logic in that?
I think that's what makes it really, really a challenge, because many people in the community would they question. We question the government all the time. We question the way things roll out and the decisions that are made. And so what makes it, I think one of the things that makes it hard when we talk about, like you, Quita, knows that I lost my godfather as well to COVID, and he did not have any underlying conditions. He went in the hospital in late March when it first hit, and he died May 14th. So he was in that first group of folks that died because of COVID, and he had no diabetes, nothing other than some bad knees and a bad back. So I think so. So while people say, is it really real, or why should I take it? But then here it is, we've lost people, and I think that's the challenge that many are having, because this discussion, I had never taken the flu shot, never. I just didn't feel that I needed, never taken the flu shot. I think I've had the flu once maybe once in my 50 years. So it did make me feel like, maybe I'm asymptomatic, maybe I'm asymptomatic and I'll be okay. There was a level of that, but then there's also a level of fear of what I've heard that people like Miss Phyllis have experienced, and I wanted to decrease my chances of having that same experience, or passing it on to someone else. But so I mean, I don't know. This is definitely a really great discussion. I think it is so important on all levels to hear all sides. I am going to roll it back over to the doctor and the nurse and see what else that they and because you hear what some of and I have to agree with David when we if you just think about it. So you gonna give me a gift card to go get a vaccine? So that
You're selling it then,
that seems weird. I don't know.
there's
Fear may not be the right word, and I understand the importance of trying to motivate people to go and give them something and give some sort of incentive. I do. I get that, and being somebody who's worked in the community for a very long time, working with young people, we're always looking for ways to incentivize because we know the good that happens after we've given the incentive and we brought them in. But it does seem, like so
quickly,
like
Nurse
the
Stokes, you said that
vaccine,
a
you're
small
gonna give
number.
me.
You said that it was a small number for to lose somebody for the price that we could pay to eradicate this thing.
Mhm.
Well, I think it's a real small number that you would use an experimental drug. If one person dies from it, it should be stopped. It should not be continued until all the bugs are worked out of it. But in all actuality, there's been well over 20-some thousand people who have died from these vaccinations. And if one person died from an experimental drug, then they should be stopped completely. But the people that have made these vaccinations, and I want the American people to hear me real good, and the people that are pushing this vaccination continue to think that this experimental drug is okay. And that's why in the last stimulus package, these companies was given immunity so that they could not be sued. Because they are being litigated so much right now, they asked the legislators to put in the stimulus package that if somebody dies from the COVID experimental drug, they cannot be sued. So if you're a reputable company, and like I said before, they have billions of dollars in litigation because of their bad practices and the crimes they've committed against humanity with these bad vaccinations. If
So
you're
I'm
a
going.
but the legitimate company is not going to ask the legislative body to make a law to say that if we kill somebody with this bad vaccination, they can't sue us. And so the
Right.
American people need to understand that if this is going to go down, there's something wrong with it.
So I think what you're saying too is part of still why this conversation is so important because for someone who I'm not a healthcare professional, I'm a community person. I can say to that like we don't know any medicine we take.
Absolutely.
You
Absolutely.
know, we don't
Absolutely.
know. We don't really know what the government is doing, and we don't really know. So it's just a really and this is what's making it so hard for people. Doctor, when you ask, the question about why are people hesitant or still on the fence, it is things like what David is talking about. It is things like just me, I'm like, I don't know what they put in anything, it's really, really a hard decision to make. And like, where did the vaccine come? I think I even asked Nurse Stokes some months back. I was like, are less people getting COVID? And I think my question, I said, are we just becoming immune to it? Because we've been coming outside a little bit. It's been, for me, I'm just thinking like it's been in the air. So am I just becoming immune to it now? So
They
do I
said
really need?
when it gets 70 degrees, that the COVID it died after 70 degrees when it first came. That the temperature went up 70 above degrees, that it would destroy the COVID. But then that was not true. And see, these are the lies and inconsistencies wearing one mask. So my question again is that 2 months ago, people that were fully vaccinated, Dr. Fauci, and the people were saying you still have to wear a mask. Wear 2 masks. And now all of a sudden, here it is, people are You're pushing people and you're separating the people in the country who's vaccinated, who's not vaccinated. And now you're trying to get people to buy into this vaccination dream.
Can I say something, please?
I'm gonna and we're getting close to wrapping up time. All of the comments have and the statements that have been made have definitely given kudos to this discussion, and kudos to all of you and giving their input and just really thanking us for being able to have this open dialogue. You know, we don't ever have to always agree. We're not. and it wasn't about, because if we had everyone on here that was for the vaccine, then we wouldn't be doing due justice. If we had everyone on here that was not for it, you know, then that wouldn't have been a healthy discussion. But go ahead, Quita.
I just want to say really quickly, you know, like you said, we could all agree to disagree. And, you know, the government is the government. That's just like politics is politics. That's just like your job is your job. And, you know, I don't really care about that. I care about my community. I care about my people. And you need to make sure that you're doing what's best for you and your family at the end of the day. So, you know, I get that, you know, the government has done this and that, but if you're vaping, if you have to come into the clinic and we have to prescribe you 15 different medications, all of these drugs have adverse events. You know, you could die if you're smoking on a regular basis, if you're drinking on a regular basis. All of these things could hinder you in your future. And if you eat meat, you know, they use pesticides, you know. So when these people are telling me this and I'm seeing them vaping and I'm seeing them smoke marijuana and things like this, it's a joke to me. I mean, it is, because you don't have a clue what you're putting in your body, but you're talking about a vaccine that could possibly prevent you from dying, because the studies have shown science makes the world go around. I mean, it is what it is. Science makes the world go around. And if I can do anything to help make the trend better for my child when she gets older, then that's what it is. It doesn't matter about anybody else. I made my decision based off of me and my family and what I want for my daughter when she gets older. So that's what I had to say.
So, Doctor, I do want to ask this question, because I saw someone put in there, and I think this is important too in terms of why people aren't coming, because you get vaccinated and then we hear there's a booster. So I saw someone put that I got the vaccine, but I'm not getting a booster. Can you just explain to everyone the reason behind that, and just so we can have clarity what that really means?
So what that really means is, when we think about vaccines, and similar to the flu vaccine, a virus mutates. You will hear on there that you have South African variants, you have British variants, you have Asian variants. Some of the ones that are coming out are very, you know, it's much easier to contract, and the results are very devastating, especially some of the ones in the Asian countries right now. So when we are still understanding this virus, a virus is a very, very complex, very small, but very complex thing. You introduce it into an environment, it will either change that environment or it will change itself. And this virus can change itself, and we're seeing different variants of it. The vaccines that we have produced so far, compared to the new variants, they do show efficacy. It is effective against the South African variant. It is effective against the British variant. But similar to when I mentioned that smallpox example, if there's a lot of places for this vaccine to hide, it will run and hide, and then it will change. It will change it to something else, and it will come right back. And that's when we start thinking about these boosters. So if the vaccine I took the vaccine in January, if the vaccine I took in January Do I know for sure that there's going to be a variant in New Zealand that pops up 9 months from now, that vaccine is going to be as effective? And that's where we are now in this kind of fight to understand the variants that pop up, compare them all to the vaccines that we have in-house, and see if we need to continue to develop something that's going to be more effective. As the virus changes, our strategy needs to change with that. And that speaks to our larger strategy for how we approached COVID, right? This was something that we had not seen before. No one had seen this before. So on day one, can I tell you that this is something where you touch a surface and it's gone in 30 minutes? I don't know. It's something I haven't seen before. So it's something that we learn about it. As we learned about it, guidelines changed, and we look at the results. Unfortunately, when we're thinking about this is very much something where you have to see the results of your actions. Did it work or did it not work? So I take a look now, the numbers are going down. The social distancing worked, the masking worked, and the vaccines have shown to work. When we think about, and I heard, quite a bit, you can die with COVID, you can die with the vaccine. That's a false equivalency, right? Because you're not looking at the full story. I'll go ahead and use the same numbers that we discussed during this conversation. If the death from COVID is 1%, the death from a vaccine person is 0.0017. So that means you have a 99% chance of surviving COVID, and you have a 99.999% chance of surviving it with the vaccine. That's a lot of nines. But if I compare that, that's 1,000-fold difference.
So we're going to shift just a minute. And I know you guys have been on here for almost an hour now, so I'm not going to, a little over an hour, I'm sorry. I'm not going to hold you much longer, but I wanted to bring in really quick. We have, are you there? Are you able to come on camera? Bring her in. She is, and I don't want to pronounce her name wrong. I don't know. Princess, and she is, I don't know, I think we're losing her, but I wanted to bring her on. She's in Nigeria, from Nigeria, and for her just to share a little bit with us if we can get her. I don't think we're going to be able to get her on. Yeah, I think we lost her. Sorry. So we have been on for
I would just like
almost an hour and a half. And so I know that, and it's late. So I don't want to hold you guys any longer. What I want to say is that this has been a really, really healthy conversation. I was watching the comments that I missed when she first came on, and a very important conversation. And I appreciate that we have been able to have differences, but still be open to hearing from one another. And Miss Phyllis she said it best. She did what she needed to do and felt what was right for her family. And even though she is in the community, a community active, she's not trying to push anything down anyone's throat. She's just telling her story, and I love that. And I love the information that was shared. And I just want to give you, Miss Phyllis, a minute to give us some final words, because you just look like a woman of wisdom. You look like a woman of wisdom.
Well, I'm a sponge. I love information, and I take it all in, and I don't take it in with any type of judgment, because we're all human, and that's the one good thing is we have choices, and that's okay. That makes us all different. That's the one thing. Whoever we believe in, or whatever we believe in, we have a choice, and we must make those choices that are concrete and that are good for us as individuals. But I do want to thank you for the invitation, and just for the conversation. I mean, and it's okay. That's why we're here, because we have differences of opinion, but we're all still the same people. And regardless of which way we get there, we all want to get to the same place, and that's health and wellness.
Right.
Because we know that all. And from Mr. Lowery, Our condolences to you on the loss of your mom and your
Absolutely.
dad within
Absolutely. Yeah.
6 months or so. This
Yeah.
is personal, really, really personal for you, and it's got to be hard hitting in any kind of way that we cannot fathom and understand on that side. But that same goes for me
Yes.
when I have to look at it from the point of view of myself, my husband, my son, and my daughter, and
Mm-hmm.
what we went through. So all of those are just individual pieces. But thank you, and I appreciate being a part. And I hope to be able to network with some of you in
That'll
the future.
that'll
Thank
be
you.
great.
Absolutely. I just
Thank
want
you.
to, and we're gonna bring it to an end. I want
Can
to
I give my
thank.
information out?
Oh, absolutely, absolutely,
um,
absolutely.
folks, in closing remarks, I'm going to say this. Folks, you do your research first. Just do not be pressured by the commercials, all
Mhm.
the antics, the tricks that they're offering to take this vaccination. Do some research for yourself and find out what's in it, what it can and what it cannot do, and then make a good conscious decision on whether you should take it or not. These are my last words to the American people. It is high time that we get our government back under control. Because of the misinformation, because of this government who has always done things behind our back and without our permission, it's time for the American people to stand up and hold the politicians and hold all of these politicians accountable for what they do. They do not work for themselves. They work for the American people, and that's how it should be. And as long as they are continuing to lie and to give out bad information and try to play games and psychological warfare on us, we need to stand strong together, whites, blacks, no matter what. That's what we're doing with Let the Truth Be Told. We're unifying all Americans together so that we can get our future back at hand, because right now the government has overstepped their boundaries. They've lied about this whole thing. And you can say whatever you want to say about David Lowery. We got plenty of numbers and we got plenty of stuff. We were the ones who filed the lawsuit with the Thomas More Society against some of the things that they've done. And we will continue to file lawsuits to get to the truth, because the American people still don't know the formulas on what they use in this scientific experiment, nor do we know the true numbers of the true death of COVID and how it came and how it affected us. And so if you want to take this vaccination, that's fine. Put something in you that you don't know about, that's your business. But to the American people, let us stop, let us research, let us stand together, and let us take our government back and let them be the workers that they should be and get our approval first before they start making decisions about our health and our welfare. Thank you.
If I could add a couple closing remarks from my side here, just from the provider perspective, we do want to encourage everyone to please get vaccinated. If you're able to, please get vaccinated. What we have seen, if you are on the fence about the vaccine, the most effective conversations that we have seen with this has been with your individual providers. So ultimately, at the end of the day, we can have town halls and we can have discussions. You can see the news reports, you can do the articles, but please have a conversation with your healthcare provider. Visit your doctor and discuss your concerns if you're on the fence, and have them kind of share their experiences and their knowledge as well. So one thing we have seen with the mistrust and distrust that we have, there's still one beacon of hope, and that is folks still trust their general practitioners. They still trust their providers. They still trust their physicians.
Right.
So I encourage everyone, please have this conversation with your physician if you're still on the fence.
Make sure you have two
And
conversations with another doctor besides one, okay?
2, 3, 4, 5,
Yeah.
10 doctors, please just speak to the healthcare professionals, speak to the healthcare community, speak to your providers. and get their input and their advice.
Love
And
it.
remember, the doctors are
Quita,
making money. They're all making money. They're all
Quita,
paid.
and
That's
Quita,
what the information is.
can we get Miss Quita to say her part? You said your part.
I swear. Same thing. I'm going to agree with Dr. Rohit. Same thing. You guys do your research. Stop listening to the conspiracy theories. Do your research. Talk to your doctors. Get in there. Do what's best for you and your family. And let's get back to normalcy. Let's get back. Forget about the government and all that. Let them deal with that. Let's talk about health and then what's going on in our community and saving our community and getting back what we know we can be. So, and if you have any questions, like I said, I'm a health and wellness coach. I love living by holistic measures as well. You can reach out to me at lsfarmerhouseofhope@gmail.com. And I'm willing to answer any questions or concerns that you may have at any time. Yolanda will tell you. So I'm here for you. But please don't let society, cause you to be in a bind.
Right. Well, thank you. Thank each one of you so very much. I really, really appreciate. I think what Doctor was saying, and I've learned this from doing the Doty report for this long period of time, is talk to your healthcare provider, your physician, the person that you trust with anything that's going on with you, versus trying to figure it out for yourself. Googling it. Really utilize that. You go to the doctor when you have the sniffles. Why we don't go to the doctor when it's something of this magnitude that hits us? It's just so. That is definitely a message that I'm saying to the people, that go to the doctor, have the conversation, and be a health advocate for yourself, but go to the person that you trust, that has a healthcare background. And I believe they're going to give you the best answer based on you, if you have that relationship. So thank you so much. We know, Mr. Lowry, everything is
all about that
everything
money.
is about
That's
money.
for real.
We can't get past that.
My last word,
That's
let
the
the truth
world.
be told. Saturdays,
That's
1
the
o'clock.
world we live
And,
in. So
and
thank
don't
you,
take the
guests.
vaccination until you know that it's for real. It's not a vaccination, an experimental drug. That's all it is.
Get educated. That's the bottom line.
Yes, ma'am.
Thank you so much, guests. We just want to give definitely a shout out to the Georgia Doty Comprehensive Health Organization for putting this together. The comments were great. I learned a lot. I know you learned a lot. But we want to thank the organization. We want to thank, we got to thank all of the sponsors of the Georgia Doty organization. Before we leave, we just cannot get past that. That wouldn't be right. I'm going to pull them up. We're going to see if we have them somewhere. Here we go. I got a long list we want to thank them for their donations, for the grants, for the awards. I got Zancac, gave Hot Meals, Heartfelt Chicago, WARP, which is the West Side Health Advocates Regional Planning Coalition, Jewel Osco, Abby, Right Healthcare, gave sanitizing wipes. We got Pastor Corey Brooks, who gave. We got Vanguard, who gave. We got Shekinah Chapel, who gave. Blue Cross Blue Shield just recently, the organization just recently got a grant from that. Again, Pfizer, the organization has actually gotten several grants funded from Pfizer and to the board and those individuals that have given individuals donation. Please go to the website, georgiadotyhealth.org. The organization is always looking for volunteers, always looking for people to join the advisory committee, even looking for board members. Of course, we want monetary donations. It's about the money, as he said. But it's definitely need funding to make the organization be viable, and so that the organization can continue to give back and continue to be a health advocate for the community and bring in those resources. I thank you for your time. This was a pretty long Doty report, but it was a great one. And I think I'll maybe see you next month for another discussion. Be safe, be well, and be great. Thank you so much.